Hi, everybody. Welcome back to our Gilda's Club Facebook workshops. We're so excited that you could join us here in our virtual clubhouse today and grateful that you could come through together in this platform while we're all staying safe. We hope that you are well and finding ways to stay connected during this time. Please let us know that you're here and watching by liking or commenting below. We'll be taking questions during today's workshop. So if you have a question, please leave it in the chat. If you're watching this after we're live, feel free to go ahead and leave it again in a comment, and we'll be sure to circle back to you as we're able to. Today, we're really excited to be joined by our Gilda's Club president, Wendy Wigger, to discuss our summer series of in-person programming. Welcome, Wendy.
Thanks, Hannah. Glad to be with you.
Yeah. So what can you kind of tell us a little bit more about our return to in-person programming?
Yeah, well, I think, you've done such a beautiful job of sending out messages as we've gone along the way here. And we've wanted to keep people informed that it's not a secret that we're going to return a little bit slower than many others in terms of in-person programming. That's been intentional. And we really anticipated that while a lot of these restrictions even now are being lifted, we're going to continue the slow and steady pace. Our priority is an organization that works with people with immunocompromised systems, is that we want to remain safe for our members, our volunteers, and our staff. So we have slowly started to take some actions. We actually had a quiet event, if you will, but on campus in June. And we recently completed the support of the LPGA, and it was so good to see so many volunteers in what I call 3D versus 2D. But at the same time, we really know that we are going to continue expanding our in-person support programs in July gradually and through August. And we want to do so in a way that has safety in mind. So we really appreciate people's patience. We're all, as we say, in this together. We're navigating it. And the fact that we might be a little unique in terms of how quickly we return back to that new normal, that people are patient and understanding because of the fact that we want to keep safety in mind for all.
Yeah. Well, I think we had some questions submitted ahead of time from some of our members or people here on social media. So thank you if you sent in a question. We're also going to be sharing a little bit more about what in-person programming will look like this summer. So you guys can get into the next few months. Wendy, right off the bat, can you talk a little bit more about why Gilda's Club is being so cautious, just so that everyone can know a little bit more?
Right. Well, Hannah, there's several reasons. At the heart of it all is, again, because we deal with an immunocompromised population in many cases. Anybody that's diagnosed with cancer or anybody that's connected with cancer, because you're going to be bringing whatever it is that you're exposed to the people in your network and in your family. So it's really important for us to be particularly careful of just really reducing all the risks possible for contracting and the complications that come with the coronavirus. We've been waiting for a vaccine for a very long time and treatment, and that's broadly been more and more available. I'm hearing some stats in terms of the number of people vaccinated in Michigan. It sounds like Western Michigan is particularly doing a great job in moving forward here. But knowing that we're in this together, for us to develop a plan that really focuses on the most vulnerable, so really looking at what is the baseline in terms of safety, and that's particularly why it's taken us so long and why our protocols are in place and will continue to be so broadly and longer than many other organizations. And we hope members will understand that it's safety of the members, the volunteers, the staff, and all the people that they're connected with. And so we're going to continue to closely monitor this. And we're thrilled to be able to start to move forward in some, what I would call safe and slow, steady steps as we go. When we're going forward and dipping our toes into the water, right now, we have planned approximately 12 in-person activities that'll be available for members. More information will be coming out in our calendar real soon. And then we'll have additional activities in August with the hope that September will look a little bit closer to being more formally open, but yet we're going to continue to monitor all of that as we go forward.
Yeah, which is really exciting. I know that a lot of our staff are excited to be able to see people in 3D, just like you mentioned,
Yes.
the LPGA. We miss you guys just as much as you miss the in-person support. We're thrilled that we were able to shift to virtual, but we're excited too to be coming back.
Yes. Yeah. Yeah. And you know, I think that's something that was very intentional in terms of our doing some of the surveys that we've done, which I know we'll talk a little bit about, but we really wanted to be conscientious of, it's not just, you know, what is MIOSHA or the CDC or the state of Michigan doing for guidelines, but we're also taking into account what are other cancer-like organizations doing? What is it that our organization, it's a heavy lift, you know, to be able to come back open and as anxious as we are and as excited as we are, we also want to make sure that we're doing it very purposefully, very strategically, and with safety in mind.
Yeah, definitely. You mentioned a little bit ago that having a vaccine was one of the, or treatment that was broadly available was one of the key factors for Gilda's Club to decide to kind of open up a little bit more. Will Gilda's Club be requiring proof of vaccination for members or volunteers wishing to attend in-person activities?
Yeah, well, you know what? We gave a lot of deep thought to that. We know different organizations are taking different approaches, both for-profit and not-for-profit organizations. And while we definitely encourage, widely encourage vaccinations for those that have the capability to do so, we will not be requiring vaccinations of our members, volunteers, or staff. This is something that we, you know, as I said, really looked at deeply. And in the initial studies of the COVID-19 vaccine, those initial studies did not include people getting treatment with drugs that suppress the immune system. And many of the folks that have are on that journey of cancer are dealing with, you know, suppressed immune systems. So people like that are on chemo or have weakened immune systems for other reasons, you know, we needed to first of all see what these studies were going to do for people with healthy immune systems. And, you know, because of this, it's not yet clear how effective vaccines might be for groups of people that have compromised immune systems. So although there's not a lot of specific information available yet on how effective the vaccines might be in people being treated for cancer, it's possible that the vaccines might not be as effective in people with weakened immune systems as compared with healthy immune systems. So, you know, despite this, medical experts are still recommending that most cancer patients get the vaccine because those with fragile immune systems are at higher risk for severe COVID-19. So getting some protection from the vaccine is better than having no protection. And as we know, it's not just the person, but it's also who are we interacting with? Who are we engaging with? Who's in that space of ours? That are they vaccinated or not? So with all that being said, we know the situation for everyone is different and for every person. And that's why we're not going to be requiring vaccinations to participate in our program or to volunteer. We certainly will encourage our members and community members that have not been vaccinated to consider doing so and discuss the risks and benefits of your particular situation with your oncology team or your primary care doctor.
Yeah. And I mean, there's still a lot of studies going on, so it's exciting to see and understand more about the long-term effects of the vaccine. And I know that played a large role in some of our slow reopening, is just understanding we don't know for people with compromised immune systems exactly how effective.
Right.
Now.
It was, I have to share just a little side note story that was interesting because, you know, because we've continued to evaluate this. When I was at the LPGA, I had a volunteer share with me that volunteering at the LPGA was her inspiration to get a vaccination because she didn't think we would have let her volunteer if she wasn't vaccinated. And I said, well, I applaud your taking the step for yourself in what felt good and for also thinking of others. And I had to share, no, we weren't going to check vaccine cards. We're not going to ask for proof of vaccination, but it was really heartwarming to kind of hear that she was thinking of not only what might be best for her, but also thinking of who might she be engaging with and participating with as well. So maybe we'll be a positive influencer in some ways.
Yeah, that's true. So for those who are going to be able to come in person, what does that look like, attending an in-person event at Gilda's Club?
Yeah, well, for the months of July and August, and as we said, we have about 12 activities planned so far for July. Right now, we are still fully vetting some of those elements here, but what we do know is that those activities that we'll do in July are going to be taking place outdoors, and social distancing will be encouraged as well. When outdoors, masks are going to be optional. Again, social distancing will be encouraged. And, whether you're vaccinated or not, we always welcome people to do what's best and comfortable for them. So while masks are optional, if people feel more comfortable wearing masks outdoors, they are welcome to do so. It will not be out of place whatsoever, I can tell you that. Restrooms will be available inside the clubhouse. And at this time, we are asking that anybody that wishes to use the restrooms, when somebody comes into the clubhouse to use it, we will require a mask, regardless of that vaccination status. And we'll also require what people are getting quite used to right now, temperature check, a health screening form. And that is in case that we find out later that there was some kind of an exposure, we know who to contact that's been maybe in a closer proximity within the clubhouse. So those are part of the process that we'll be using if people choose to come to any of the in-person events. The other element that we're asking for is that we're going to ask people to RSVP their attendance for any in-person event. That allows us to better prepare the space appropriately, know how many people are attending. And, it's so hard to know, Hannah, at this time, like, if we have an in-person event, might there be 3 people? Might there be 30 people? I don't think there'll be 300, but you just don't know, right? Because I think so many people are excited to be able to reconnect in a way that we haven't been able to, as and as deeply perhaps as what it'll feel like when we start to see people in 3D instead of just 2D.
Well, and I know that they're taking place outdoors, and today's a great example, at least where I am right now, where it was blue skies this morning and it just rained, and now it's back to being sunny. So what happens if it rains when we're
Great question, because your blue skies were what I had about an hour ago, because I know you and I are a little bit of a space of geographic distance here. What we're going to do is we're going to really try to use similar to what we do in our bad weather policy. Nobody wants to mention that 4-letter word snow. But we took our winter weather policy and we looked at it from a standpoint of spring and summer. And so right now, the best way for us to approach this is that if it's raining, your activity may be canceled or it might be shifted to a virtual format. And that's going to be the easiest way than trying to decide, do we open up the clubhouse when we know that right now we're still getting the clubhouse ready for that kind of a engagement or more activity at this point. So our hope is that we would be making the decision for any daytime activities by 8 a.m. that morning. And for any evening activities, we'll make it by 2 p.m. that afternoon. And then we'll be able to communicate that out to the people that have RSVP'd for those events. And with Michigan weather being what it is, as Gilda would say, it's always something. Be prepared. If we need to shift or pivot again, we'll do that. But that's our plan at this time.
And hopefully we won't be saying snow anytime this summer.
That's one thing we really didn't have to put into play this past 15 months is the snow, the bad weather policy. So
very true.
Yeah.
Now I know that we said that we're going to be sharing our calendar a little bit later this week, early next week, but we can share now that there will be some specific support groups that will have the opportunity to meet in person. as well as some general member social activities or wellness activities. Some of the questions we received before our live had to do with specific groups or activities, things like, is art workshop going to be meeting, or things like the kids program and supper together. Wendy, could you talk about the kids program as well as supper together? And for, as a member, once the calendar is out, if my group or activity isn't meeting this month, how do we know what was chosen, and when might it be back?
Yeah, well, there's a lot there in those questions. So let me see if I can kind of pick it apart a little bit. You know, I think first of all to say that we would love nothing more than to be able to say everything's back and we're all going to do everything all at the same time and lift all of these restrictions. And as I said before, reality is that safety comes first, and the health and safety of the members, volunteers, and our staff. So we are going to be what I will call, the team has heard me say, we're going to, you know, crawl, walk a little faster, maybe do a slow jog, and then we'll run forward as we keep going here. So it is going to be slow, and we miss everybody, but we really want to be able to do things in a way that feels right. So the calendar of activities and events, why we chose what we did was partially informed because we did some surveys. We did surveys with our members, we did surveys with the volunteers, and we also did surveys with our staff. What we really wanted to do is to give people an opportunity to give us feedback. What are you ready for? And we really appreciate those people that took the time to fill out the survey, because we rely on that information and it helps us with our return to in-person plan. So there's been a number of people that we've gotten some feedback from. We took into account as well the space outside and what we could do, let's say, comfortably outside in a way that still provides the privacy and the health, social distance, and the safety for the people that are involved. So those were factors that went into our deciding what are the things that we're going to try to do in July. And then we'll be announcing more things that we'll be doing in August as well. So, you know, the fact is that there's a lot of factors that have gone into the program that we're starting with, and emphasize that word start, because I think when we talk about the summer series, we don't want people to think, oh, that's the only thing that's returning back. It is for the summer to give us that gradual reopening, work out bugs if there's any bugs, kind of figure out things that might need tweaking here so that we can more fully open at a later time here. So just because your group or activity isn't on the list for July doesn't mean it won't be in the future. And we're going to continue to work through our plan in August and September as we build back to a larger in-person program. Mm-hmm. I can tell you, Hannah, that there's a couple of things, question I think that came through, and something that we're still looking at very closely is, you know, what do we do with our kids programming? And there's, you know, just as anyone else sees in the news, we see some of the same things in the news as vaccinations are available for kids of X age. We're not sure, you know, what school is going to look like for all people in September. So right now we've decided for the month of July that we don't have any kids programming in person in our July calendar. We do, however, have 2 family and youth virtual support group opportunities each week on Thursdays. And we also, of course, still have the teen cancer and the teen grief support. With that said, we are working through holding elements of our Camp Sparkle Day Camp for the elementary age that will be held at Gilda's Club. And we're looking for that to be in person in August, very early part of August. So be on the lookout for more of that information coming shortly. I've been getting some updates from the program team, Kaylee and team and such, and it will not disappoint. It is going to be, I mean, I was like, okay, can I go to it? Because I may be a little bit older than the targeted age group, but it sounds like a lot of fun. Yes. So we're going to, you know, look for more information on that. That is something that we plan on having. The one thing that we, I think is still a little bit squishy right now is suppers together and, you know, or volunteering in the clubhouse to provide food and baking. I miss Penny and other people's warm cookies that have been
Mhm.
so delightfully a part of the clubhouse and brings that warm and welcoming feeling and the smells and all of what Dorothy and the Chocolate Factory brings to the organization here. I know we've had some questions on that, and at this time, we're just not really sure when that will come to be quite yet. We'll continue to monitor the health and safety rules for food and providers, and we'll be evaluating if we can meet those standards. We're right now, it's just kind of looking at things from a safety, from a budget standpoint, from a staffing standpoint, and what makes sense. If you're really itching to, do something for the clubhouse, we do have volunteer opportunities. I want to kind of put an appeal out there at the moment that Mark and a small group of volunteers have continued to keep the grounds looking as beautiful as they normally do and doing some of the gardening, and we can always use help there. So if you just don't, if you're good at your hands and baking and cooking, you might be good at your hands doing some gardening and helping on the yard work.
Yeah, and I'll also add that we have some other upcoming event-based opportunities, not happening at the Clubhouse, but still benefiting Gilda's Club. If you want to try something else, you can get in touch with Ben, our volunteer manager, I'll add his information to the bottom of this description after we get off.
Great. Let's keep Ben busy.
Keep Ben busy. One of the other questions we've gotten is, can I stop by the clubhouse to say hi? Or will there be a social opportunity for members this July?
Yeah, boy, I think the probably the most regular person we've had at the clubhouse has been the gentlemen or the women that deliver the mail, and an occasional UPS truck. In addition to, of course, we have a couple of key staff members that have consistently been present, Mark being one of them. But our physical clubhouse is just not really ready for drop-ins or general use at this time. And in all honesty, we have some staff on site, but not everyone's present at this point. So while we all miss all of you and look forward to seeing you, I really ask that you don't just stop by to say hi or ask for things inside the clubhouse. I know we've had a few inquiries. Can we use the computers? Can we use the library? It makes it really difficult for us right now to be able to open the clubhouse to the public without having all of those elements in place. So with that said, we do have a couple of really exciting outdoor opportunities that are socially distanced summer social events that are planned for our members. And one is Tuesday, July 13 at our Low Clubhouse, Senior Neighbors. We'll be there from 6 to 7. And there'll be some activities and such going on there. So we're excited, and we welcome anybody that's been active in the Low program or is interested in the Low program, or just wants to reconnect, to feel free to stop by. We'll have some additional details and information coming as we go forward in terms of any safety factors that might be, to be keeping in mind and such for that. The second opportunity is going to be Wednesday, July 21. And Wednesday, July 21 at the Grand Rapids Clubhouse from 5:30 to 7:30, we are going to invite people to a summer social. And by that, I mean, be it members, volunteers, the people that are connected to Gilda's Club in some way. That summer social will also be the time that we're going to kick off the West Side Walk fundraiser, which is happening on Saturday, September 18. But people that are interested and hungry for more information there will get some more information. And if you're just plain hungry, we'll have a few snacks too.
We will.
With the thing that just like all of the other activities that we are, planning for the summer, is that we do plan and ask that people RSVP. That'll give us a really good sense as to what that attendance is going to look like and how we best prepare. And as we get closer to those dates, we will, of course, re-promote those times and any additional details that people need to be aware of.
Yeah. So you'll see invitations for those events coming out alongside our calendar in the next couple of weeks.
Yep.
Okay, we talked about questions from those who are ready to come back to in-person programming, but we also know that for some of our members, there are some that aren't ready to come back. given their circumstances or their physical distance from the clubhouse. For members that prefer a virtual format, will there still be virtual options available to them?
Absolutely. I think if there is a gift that came out of this pandemic and what we've had to experience, a couple of our learnings has been, while we had to be physically distanced, it's just as important always to stay emotionally connected. But what we also discovered is that people could engage in Gilda's clubs in ways that we hadn't experienced before. I know, Hannah, that we've had some people that have Zoomed in from, the hospital while they were getting treatment, and some people that had Zoomed in that wouldn't geographically normally be able to drive as easily or comfortable in doing that. So this is a gradual process. It's going to take time. Our virtual clubhouse is going to stay around for some time. And I think in addition, even once we're more fully open, there's going to be elements that we will want to sustain. Funding, is always a factor there, but we're hoping that we can sustain some of those virtual options as well. So that is one of the things that we're planning to do. And, really, the virtual clubhouse, it wouldn't have been possible if we hadn't had the kind of support that we've had from people out there being willing to say, okay, I'm not really sure I understand all this technology, but I'll give it a try. And I have to do a shout out to some awesome team members at Gilda's Club. Wendy Jones is one, but I can't mention all 20 plus of our staff, but I think the staff has done such a great job of really trying to make accessible and easy as possible people that are comfortable in joining us in that virtual format. So that will remain while we're still working on coming back to our traditional format. At this time, we don't have the plan or the ability at this time to do a hybrid. So there will be things that are on the calendar that are going to be in person, for which we ask you to RSVP. And then there will be a vast majority of our programs still right now will stay virtual. And right at this time in July, we don't see anything that it would be, you could do both at the same time, if that makes sense. So as you're going to either have to make a choice of participating in a virtual format or participating in an in-person program.
Yeah. And I can also add that some of our groups that are going to be in person, it's not like every meeting they're having this month will be in person.
Great
so you'll
point.
still be able to get that virtual connection if that's what you're looking for. I'm sorry, I
Yeah.
have a dog making a little bit of noise right now.
Oh, I think many of us out there can relate to the joys of having our four-legged fur babies around us. It's nice and comforting, but it's not always quiet.
Definitely. I don't see any other questions that have kind of come in. Susan, we're going to miss you on the 21st too. It looks like happy birthday. It sounds like it's your birthday. We'll miss seeing you. But Wendy, was there anything else that you wanted to talk about today that we haven't had a chance to touch on?
I think we really covered quite a bit here, Hannah. And I think I just want to share my appreciation for everybody that has participated in a virtual format, anyone that has given us feedback through any of the surveys that we've had, the volunteers that are still out there anxious and ready to go. I mean, you all know that we can't do what we do without your support on so many different levels. So thanks for understanding that it's a slow roll for us in the return, but that's intentional, and we are very much looking forward to very gradually folding back some of that in person, because we want to see you in person as much as you may want to see some of us or the other members and volunteers. We'll get there. It's just that we need to get there safely and soundly.
Yeah. Well, thank you so much, Wendy, for joining us today and answering some of the common questions we've had from members. If you have a question that we didn't answer, you can leave a comment below or give us a phone call. You can reach us at area code 616-453-8300. And we'll be honest, we might not have an answer right away, but we'll do our best to answer your questions. And we welcome questions because it helps us think about things that we hadn't considered before sometimes. So thank you to everyone who's joining us on our live. We hope that you've gained something from this. And if you're interested in learning more about the program that we talked about, which is a free cancer and grief emotional health support program, you can give us a call at that phone number I mentioned, 453-8300, or visit our website at gildasclubgr.org. We hope that everyone is staying safe, staying well, and we look forward to seeing you guys soon. Bye.
Bye. Thanks.